The Golden Age of Microbiology began around 1850 with Ignaz Philipp Semmelweis. Semmelweis was instrumental in the development of aseptic techniques as a defense against germs that were causes of disease, according to germ theory. Ignaz Philipp Semmelweis was instrumental in the development of aseptic techniques to defend against these so-called germs. Semmelweis discovered that hand washing in obstetrical clinics drastically reduced the incidence of what was called childbed fever. Now, Semmelweis's discovery was tested and proved over and over again. However, the scientists and physicians of the day were reluctant to accept that something as trivial as hand washing could actually reduce mortality rates, and also because the idea of miasmatic theory was prevalent and widely still accepted within the medical and scientific communities. In fact, many medical practitioners refused to wash their hands and were even insulted and offended at the idea that their hands were contaminated. Semmelweis was given the honorary name of the Savior of Mothers. So this fever was common in the 1850s and often fatal. Aseptic techniques that he created involved disinfecting the hands with a chlorinated lime solution, and he published his findings in a book he titled Etiology, Concept, and Prophylaxis of Childbed Fever. Non-sterile environments were still commonplace in the medical community, resulting in extraordinarily high mortality rates of approximately 50% among patients who had undergone various surgical procedures. Semmelweis demonstrated that non-sterile environments that the patients endured during surgeries led to these post-operative infections that caused these high mortality rates. Semmelweis concluded that these infections were due to unseen microbes that were able to travel through the air, or to travel from person to person through direct contact, or from object to person, causing illness and death. These infections were, in fact, so common, they were termed ward fever. Unfortunately, Semmelweis's ideas were not popularized until after his death, when Lister and Louis Pasteur continued his work in antisepsis. Louis Pasteur was one of the proponents of the germ theory, stating that germs are the cause of infectious diseases. Semmelweis's ideas were finally popularized after his death, due in part to a series of experiments performed by Louis Pasteur. These experiments performed by Louis Pasteur confirmed the germ theory, and Joseph Lister, who practiced and operated using hygienic methods with great success. Joseph Lister helped to further the work of Ignaz Semmelweis, who had developed the practice of sterile techniques and demonstrated the link between non-sterile environments and disease. In 1865, Joseph Lister developed the practice of antisepsis, which is the chemical disinfection of external living surfaces. The medical and scientific communities were more accepting of Semmelweis at this time, largely due to the overwhelming evidence produced by many scientists and physicians at the time, including work done by Louis Pasteur that provided overwhelming evidence in support of germ theory. The medical field adopted many of the aseptic techniques set forth by Lister. These methods of sterilization and decontamination became the new standard for patient care. A great many of the aseptic techniques developed by Joseph Lister are still in use in the medical field and laboratory field today. Listerine was developed in 1879 by Joseph Lawrence and was named after Joseph Lister in honor of Joseph Lister's contribution to antiseptic surgery. Thank you for watching.